guys, my name is John Lloyd Ditarana and I am a student nurse from Wesleyan University, Philippines, and today's video is I'm gonna show you how to properly perform the suctioning of a newborn using valve syringe. So the purpose of this is to remove visible mucus secretions and vomitus from the newborn's mouth or nares. Assess for the following. Assess for the mouth and nose for visible secretions or vomitus. Auscultate the newborn's lungs to evaluate for evidence of freckles and the wheezes. Also, assess for the functioning grip and the valve syringe. And lastly, we have to assess and check for the air drops. Gather and prepare the following materials needed. We have the lined hypotrade or Mayo table. We have the dry and pre-warmed blanket. We have the clean valve syringe. We have the mask and pair of sterile gloves. And lastly, we have the receptacle for the mucus drainage. First of all, we have to do the hand washing and wear sterile gloves. As the infant's head is born, suction mucus from the mouth is to prevent aspiration of secretions. So compress the valve before insertion to prevent injury to the newborn's oral mucosa, and gently insert the tip of the valve syringe into the dependent side of the newborn's mouth to collect all the drainage. So release the compression on the valve to allow for the re-expansion and the collection of the secretions. So next, we have to remove the valve syringe from the newborn's mouth and gently squeeze the valve to release the collected drainage into the appropriate receptacle or onto the tissue. So next, we have to do. As soon as the infant's body is born, hold the infant with the head slightly dependent. Next is keep the infant warm by drying and providing radiant heat. Repeat the steps to suction the other sides of the newborn's mouth. If necessary, repeat the steps to suction each nares. So next, we have to discard the collected secretions properly and clean the receptacle. And after that, you can now wash the valve syringe in warm and soapy water. You can also rinse and dry. Next, we have to place the valve syringe back in the newborn's baseline for future use. And after that, you may now remove your gloves, discard properly, and wash hands to prevent spread of microorganisms and also to protect the nurse and the client by reducing the transmission of bacteria and microorganisms. Next, we have to reassess the newborn's lungs, provide reassurance and comforting to the parents and the newborn. So next and lastly, we have to document procedures on the newborn's chart. Timely documentation helps to ensure the patient's safety and also provides record of the client's care and serves as baseline for further management. And that's all for today, guys. I hope you learned something from me, and goodbye.